HPFT. Both? No. Right. It smells like woodsy. Left. Sharp. Dry. Wet. Left.
Hi Angelina, my name is Dr. Matt. I'm going to do your exam today.
Okay.
So first let's sanitize our hands, and can you please verify your first and last name and your date of birth?
Yeah, my first name is Angelina, my last name is Rose, and my birthday is June 21st, 1997.
Okay. Do you have any allergies?
No, I do not.
Are you taking any medications?
No.
Do you have any medical history?
Not that I'm aware of.
Okay, I just see here that you have migraines.
Yes.
Do you still suffer from those?
Not as much anymore. They're definitely not as often, but I do get them every once in a while.
Okay. Okay, so I'm going to talk now about the chief complaint. Go ahead and tell me what's bothering you the most.
Yeah, so it's really just like lights, especially like when I'm at work and in the office, like having the overhead lights. It just puts a lot of stress onto my eyes, and I just, I do feel like tension in my head, and so I just wanted to talk to you about it.
Okay. Have you noticed anything abnormal with your skin, with your taste or smell?
Really just breakouts on my skin, but other than that, no.
Okay. Okay, and have you had any surgeries, brain surgery, eye surgery, or spine?
No.
Okay. No surgeries. Okay, what we're going to do today is we're going to test all 12 cranial nerves, do a vision check as well, and look at your iris and pupils to see how they're dilating. I'm going to do a sensory exam as well.
Okay.
And then I'm going to take a look at your spine to see if there are any abnormalities that could be causing that light sensitivity.
Okay.
All right. Okay. Have you noticed any changes in your basal temperature?
Mm-mm.
Okay. When was your last checkup?
I'd say about a month ago.
So you do tend to go to the doctor pretty frequent?
Yeah, I do yearly physicals and everything like that just to have a checkup.
That's good. That's good. Okay. I'm going to put this under your tongue. I'm going to have you hold it for me, please. Okay, let's go ahead and take a look at this. It's 97.4. And then this will go on your index finger. Go ahead and relax. Have you ever had your blood pressure taken before?
Yeah.
Okay. So I'm gonna use the right arm.
Okay.
You don't have to let the sleeve here. You can just leave it like that. One 10/61. That's normal. And let's check this as well. So oxygenation is 97% on room air, heart rate is 63. I would say very normal vital signs. Did you have anything to drink cold before coming in?
I had a water bottle earlier this morning.
Okay. Right. Let's go ahead and check your vision first. Okay, I'm going to ask you to look straight at my nose. Pupils are round and reactive to light. And accommodating. I'm going to go ahead and just lower your eyelid here. No increased redness. I would say no issues with your liver either. Now go ahead and follow the light with your eyes only. Don't move your head. I'm going to ask you to cover one eye. Okay, and go ahead and tell me when you don't see the light in your field of vision anymore, okay? Keep on looking straight. Okay, let's do that one more time.
No. No.
Okay, let's go ahead and switch eyes.
No. 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 No.
Okay, go ahead and cover your right eye.
Okay.
And hold this Snellen chart, arm's length. Okay, can you please read this last row starting with the first letter towards the right?
HPFTL.
Okay, and what letters here?
J.
Here.
O.
What color do you see here?
Red.
Here.
Green.
What number do you see here?
7.
Here.
4.
Which circle is larger, 7 or 8?
8.
Okay, so good spatial vision there. Let's go ahead and switch.
Okay.
Arm's length. Okay, so I'm going to have you read the same row starting with the first letter towards your left.
L T F P H.
Okay. What color do you see here?
Red.
And here?
Green.
What number do you see here?
5.
And here?
3.
Which circle is larger? 1 or 2?
2.
8 or 9?
9.
Okay. Go ahead and cover one eye for me. How many fingers am I holding up?
2.
And now?
1.
And now.
4.
Okay, so no double vision there. Let's go ahead and switch eyes. How many fingers?
2. 3. 1.
Excellent. All right. Go ahead and close your eyes. And tell me with which ear you hear this sound.
Left. Right. Both.
Okay. Yeah, that's perfectly normal.
Left. Both. Left. 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 Right. Left. Both. Both. Both.
Okay. Now we're going to do a vibration test. Go ahead and tell me when you don't hear the vibration anymore.
Okay.
So you're also going to feel it, but I want you to tell me when you don't hear it anymore.
No. 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 No.
Go ahead and tell me which position here is louder, okay?
Okay.
This is position 1 and 2.
2.
1 and 2.
2.
1, 2,
1.
1, 2.
1.
Tell me when you don't feel the vibration anymore.
No. No.
Okay, very good. I'm going to touch you with a sharp object. I am almost sure that you're going to feel it. I think if there's any sensory problems, you might have it on your back in the cervical area.
Okay.
But I just want to be sure that there are no facial nerves that are not damaged.
Okay.
Go ahead and close your eyes and tell me if you feel this on the left or right.
Left. Right. Left. Right. Left. Right. Left. Right. Left. Right.
Okay. That was perfectly normal. Okay. Go ahead and close your eyes.
Okay.
And I'm going to bring something that's very strong. It has a very strong odor. So I need you to tell me if you can identify the smell.
Okay.
Okay. This one is very close to your nose, I would say.
It smells like woodsy.
Okay. I will take that answer. And I'm just going to hold it a little bit farther from your nose.
It kind of smells like chai tea.
Okay. I'll take that answer. It's definitely a concoction of herbal mixtures. Now we're going to do a different scent, and This will be a little bit farther from your nose, farther than the last that you had.
It kind of smells minty.
Minty, perfect. So I'm not noticing anything abnormal with your smell. Now, I do have here a few tastes. I'm going to put a piece of paper on your tongue. It's going to be pretty strong, so if you are able to identify, that's great. If you're not, don't worry about it.
Yeah, I'm not sure.
Okay.
That one's definitely sweeter, like sweet.
Okay.
That one's better.
Bitter. Okay. So the first one was also bitter, which means that you were able to kind of train your sensories on your tongue in these seconds, and that tells me that everything looks very good. We're gonna go ahead and have you change into a gown, and I'll do a full body checkup just to check for any sensory problems that you might have, especially on the back and the neck area.
Okay.
I'm gonna start by palpating your cervical spine. Looking at the curvatures to determine if there is any abnormal movement. Okay, I'm going to do a little bit of more movement here. Let me know if you feel any pain. I'm looking for any abnormal responses, neurologically speaking. There is a lot more nerve ending towards the spine, so there is increased sensitivity here. And sometimes we may see what's called a pulsation, a nerve pulsation. Okay. I'm going to take a few measures. Okay, we're looking for asymmetry. 60.5. Usually we can see a difference between left and right. That indicates an imbalance. .3. Okay, now I'm going to measure each section of the spine individually. So I'm counting all thoracic vertebrae. Okay, C6, 5.5. Okay, moving down to the lumbar area. 6.2. I'm going to do a skin test. You're going to feel something wet and a little bit chilly down the spine. A little bit of redness coming from the thoracic area. I would say it's bilateral. Going to do a sensory test. This is going to feel a little bit cold. I'm going to put a little bit on each side. This will allow me to perform the test. And We usually want to make sure that both sides are uniform. Okay. Go ahead and tell me what letter I'm drawing.
H.
Okay, now tell me what shape I'm drawing.
A circle.
Okay. What about now?
A triangle. A square.
Okay, what shape is this?
I don't know.
Okay, what letter is this?
B.
Okay, what letter is this?
I'm not sure.
Let's do that one more time.
I.
Okay. What number is this?
3.
What about now?
2.
Okay, and now?
8.
Okay, perfect. What number is this?
11.
Okay. What letter is this?
C.
Okay. What shape is this?
A triangle.
And what letter is this?
A P.
Perfect. Go. Okay, now I'm going to touch it with two textures. Go ahead and tell me if you feel this on the left or right.
Right. Right. Right. Left. Left. Right. Right. Middle. Left. Right. Middle. Middle. Right. Right. Both. Both.
Okay. I'm going to touch you with two textures. One, it's going to feel dull. This is what dull is going to feel like. And one is sharp. This is what sharp is going to feel like. Are you able to identify those two sensations? Okay.
Yeah.
So go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp. 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 Dull. Dull.
Go ahead and tell me if you feel this sharp all the way up.
Yeah.
And what about now? Does it feel sharp all the way up?
Yeah.
Okay. Go ahead and tell me if you feel this sharp left to right.
It goes left to right, yeah.
Okay. Does this feel sharp all the way left to right?
Yeah.
Now go ahead and tell me if you feel this dull all the way down.
Yeah.
And the same thing.
Yeah.
Same thing.
Yeah. Yeah.
Okay. Now I'm going to start from the middle all the way to the hairline. Go ahead and tell me if it feels dull all the way up.
Yeah. 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 Yes.
Okay. I'm going to touch it with two textures. One, it's going to feel wet. Go ahead and tell me if this feels dry or wet.
Wet.
Good. And the other one is going to feel dry. Go ahead and tell me if you feel this dry or wet.
Dry.
Okay. So I know for sure that in these points you're able to identify the proper sensation. I'm going to continue all over the back and do the same thing.
Wet. Dry. 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 Wet. Dry. Wet. Dry. Dry. Wet. Dry. Wet. Dry. 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 Wet.
Okay. So I was able to do this test as fast as I could. And that's kind of like not to let your mind know what's coming next. It really helps me to determine if you're able to sense involuntarily, kind of, and not think of what you should be saying. I'm not noticing anything abnormal around the spine. I do have one more test that might be able to tell me exactly what's going on today, and then we'll do a prognosis. Okay, go ahead and tell me if you feel this on the left or right.
The right. Left. Left. Right. Right. Left. Middle. 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 Left. Right. Middle. Right.
Okay. Let's go ahead and sit back up and I'll tell you about the treatment. Okay, Angelina, it does look like you do have a deficiency in vitamin B, and that could result in your headaches and a little bit of vision sensitivity and light sensitivity. We're going to go ahead and prescribe a high dose of vitamin B. We're going to do 1 shot every month for the next 2 to 3 months, and then we're going to reassess and see exactly where your levels are.
Okay, sounds good.
Okay. Okay. Besides that, do you have any questions for me?
Not that I can think of.
Okay. Thank you, Angelina, for
Thank
letting me
you.
do this exam on you, and I'll see you back in the next appointment.
Yes, thank you.